Don't miss these 8 early prostate cancer signs. The secret to protecting your life. Imagine waking up one day and noticing your body isn't quite the same. Subtle changes, fleeting but persistent. Do you dismiss them as mere signs of aging? Or do you listen to your body and act swiftly to safeguard your health? Prostate cancer, a silent adversary, lurks in the lives of millions of men, with over 288,000 new cases projected in the US alone this year. What's chilling is that it can remain undetected until it's too late. But here's the empowering truth. You hold the key to rewriting this story. Early detection can boost survival rates to an astonishing 98%. In this journey, we'll unveil 8 early signs of prostate cancer you must never ignore. Join us, because your health isn't just a choice, it's a responsibility. Don't forget to hit, share, and comment to spread this life-saving message to others. The prostate, a small walnut-shaped organ nestled beneath the bladder, is a silent hero in male reproductive health, producing fluid that nourishes and protects sperm. But when cancer strikes, it can transform this organ into a threat. Prostate cancer, often beginning as adenocarcinoma, can grow quietly for years without leaving a trace. Yet, don't let this silence deceive you. Some forms of prostate cancer progress slowly, almost harmlessly for extended periods, while aggressive types can spread rapidly, attacking bones, lymph nodes, and other organs, leading to severe complications. What makes prostate cancer particularly insidious is the ambiguity of its early symptoms. Unlike a heart attack or a broken bone, conditions with clear signals, prostate cancer can hide, causing many men to delay checkups until the disease has advanced. Factors like genetics, ethnicity, and lifestyle add layers of complexity. For instance, African American men face a significantly higher risk, with a 60% greater incidence rate than their Caucasian counterparts, according to data from the American Cancer Society. This underscores the critical need for awareness and early action, especially for those in high-risk groups. Let's dive into the 8 early warning signs of prostate cancer. These signals may be subtle, easily mistaken for routine issues, but they are your body's alarm bells. Heeding them could be the key to protecting your life. 1. Frequent urination and nocturia. Have you ever found yourself waking up multiple times at night to urinate? Not just once, but several times? Or do you feel the urge to rush to the bathroom more often during the day, even without drinking much? Frequent urination and nocturia, waking to urinate at night, are among the earliest red flags of prostate cancer. When the prostate enlarges or is affected by a tumor, it presses on the urethra, obstructing urine flow. This makes the bladder more sensitive, prompting urination even when it's not full. You might notice a weaker urine stream or a sensation of not fully emptying your bladder, causing ongoing discomfort. This symptom is often attributed to aging or benign conditions, like benign prostatic hyperplasia, BPH. However, its persistence and increasing severity raise concern. A study published in the International Journal of Cancer found that prolonged urinary changes are linked to prostate cancer in 30% of men over 50. Beyond physical disruption, nocturia can wreak havoc on sleep, leading to fatigue, reduced work performance, and mood swings. For example, a man in his 60s might start avoiding long trips due to anxiety about finding a restroom, limiting his social life. This illustrates how the symptoms' impact extends beyond the physical affecting mental and social well-being. If you're urinating more than 2 to 3 times per night or feel frequent urges during the day, track the frequency and related symptoms, e.g. pain or weak stream, for a week. Then consult a urologist. A prostate-specific antigen, PSA, test or prostate ultrasound can pinpoint the cause and provide peace of mind. Don't let complacency delay early detection. A small step today could shape your future. 2. Painful ejaculation. Painful ejaculation is a sensitive topic, but it's one you can't afford to ignore. If you experience discomfort or pain in your penis, testicles, rectum, or lower abdomen during or after ejaculation, it could be a warning sign. The prostate produces seminal fluid, and any inflammation or tumor in this gland can disrupt the process, resulting in dull or sharp pain. This discomfort may linger for minutes or even hours post-ejaculation, sparking concern about your reproductive health. Men often overlook this symptom due to embarrassment or the assumption it's temporary. Persistent or worsening pain, however, may reflect serious changes, such as prostate cancer or chronic prostatitis. A study in the European Urology Journal found that about 10% of men reporting painful ejaculation had prostate abnormalities upon examination. The psychological toll is significant. This discomfort can lead to anxiety, reduced libido, or strain in intimate relationships. For instance, a man might avoid sexual activity due to fear of pain, creating emotional distance with a partner. The symptoms inconsistency, appearing sporadically, can falsely reassure men, but this unpredictability underscores the need for medical evaluation. Honestly, track the frequency and intensity of pain for a month. If pain occurs more than twice or is accompanied by symptoms like urinary issues or blood in semen, consult a urologist or men's health specialist. A physical exam and imaging tests, such as a transrectal ultrasound, can identify the cause. Openness with your doctor not only aids early diagnosis, but also restores confidence for a healthier life. 3. Blood in urine or semen. Seeing blood in your urine, hematuria, or semen, hematospermia, is an alarming experience. Whether it's faint pink streaks, bright red clots, or only detectable under a microscope, this is a sign you must take seriously. In prostate cancer, blood may appear due to a tumor damaging blood vessels near the prostate, causing blood to mix with urine or seminal fluid. The symptom can arise suddenly or recur intermittently, heightening anxiety. This sign is not specific. It could stem from urinary infections, kidney stones, or trauma. A study in the Journal of Urology revealed that about 15% of hematuria cases in men over 50 are linked to prostate issues, including cancer. This highlights that self-diagnosis or delaying a checkup is a risky mistake. The psychological impact is profound. Spotting blood can trigger intense fear, leading some to avoid addressing it, or postpone visits due to dread of the results. For example, a man might choose to wait and see if the blood disappears, only to find months later that the condition has worsened. Blood in semen can raise concerns about fertility or sexual health, adding stress. If you notice blood in urine or semen, even once, contact a doctor within 48 hours. Document the timing, amount, and any accompanying symptoms, e.g. pain or urinary difficulty, for clarity. Tests like urinalysis, ultrasound, or cystoscopy can determine the cause. Acting swiftly not only aids diagnosis, but also alleviates anxiety, providing clarity about your health. 4. Pain while sitting. Pain or discomfort while sitting, particularly in the pelvic region, is an often ignored warning sign. When the prostate enlarges or is affected by a tumor, it exerts pressure on surrounding tissues, causing aching, nagging, or sharp pain. In advanced stages, cancer may spread to nearby tissues, making sitting, whether at a desk or on a couch, uncomfortable. The pain may radiate to the lower back or buttocks, disrupting daily routines. This symptom is frequently mistaken for less serious issues like muscle strain, hemorrhoids, or chronic pelvic pain syndrome. Its persistence and association with other signs, such as back pain or urinary changes, set it apart. The Journal of Clinical Medicine notes that about 20% of men reporting pelvic pain show prostate abnormalities on imaging. The psychological toll is notable. This pain can deter you from activities like working, driving, or socializing, diminishing quality of life. For instance, a man might decline a dinner invitation due to fear of prolonged sitting, leading to social isolation. Pain while sitting may signal early advanced prostate cancer, especially when paired with systemic symptoms like fatigue or weight loss. If sitting pain persists beyond a week or worsens, monitor factors like sitting posture, pain duration, and related symptoms. Consult a urologist or orthopedic specialist for a comprehensive evaluation. Tests like an MRI or prostate biopsy can assess severity and guide treatment. Don't dismiss this sign. Listening to your body could be the first step to averting a bigger issue. 5. Pain in back, hips, or chest. Persistent pain in your lower back, hips, or chest is a red flag you can't ignore. When prostate cancer metastasizes to bones, a common complication in advanced stages, it can cause deep, unrelenting pain that doesn't ease with rest. Unlike muscle aches from exertion, this pain often worsens over time and may be accompanied by stiffness or weakness in affected areas. It can strike suddenly or build gradually, impacting mobility or even restful sleep. Bone metastasis is a key reason prostate cancer becomes harder to treat. The American Cancer Society notes that about 60% of advanced prostate cancer cases involve bone metastasis, often targeting the spine, pelvis, or ribs. This not only causes pain but also raises risks of fractures or nerve compression. The emotional impact is significant. Chronic pain can lead to depression, anxiety, or a sense of helplessness, especially if the cause is unclear. For example, a man might stop playing golf or gardening due to back pain, losing sources of joy. This symptom can be confused with conditions like arthritis or disc herniation, delaying diagnosis. If you experience unexplained pain in your back, hips, or chest for over 2 weeks, seek medical evaluation immediately. Note the timing, intensity, and triggers. Tests like bone scans, PET scans, or bone density assessments can detect cancer spread early. Prompt action not only manages pain, but also opens doors to more effective treatments, preserving your quality of life. 6. Swelling in legs or feet. Swelling in your legs or feet, known as edema, may seem unrelated, but can be a subtle sign of serious trouble. When prostate cancer spreads to lymph nodes, it disrupts the lymphatic system's fluid drainage, causing buildup in the lower limbs. This swelling often comes with heaviness, tightness, or mild pain when touching the area. The skin may appear red, hardened, or altered in texture, adding to discomfort. Cancer-related edema differs from swelling due to prolonged sitting, standing, or circulatory issues like venous insufficiency. It tends to persist, resists simple remedies like leg elevation, and may worsen over time. The Journal of Clinical Oncology found that 10 to 15% of men with advanced prostate cancer experience edema due to lymphatic obstruction. Beyond physical effects, swelling can limit mobility, making walking or wearing shoes difficult, and may cause self-consciousness or embarrassment. For instance, a man might skip family gatherings due to concerns about his swollen legs, leading to isolation. Edema often signals later-stage cancer, emphasizing the urgency of early evaluation when paired with symptoms like pelvic pain or urinary issues. If swelling in your legs or feet lasts beyond a few days, or includes signs like pain, redness, or skin changes, contact a doctor promptly. Track the swelling's timing, severity, and related symptoms, e.g. nocturia or weight loss. An ultrasound, CT scan, or blood tests can identify whether lymphatic obstruction or another issue is to blame. Don't underestimate this sign. Timely action can prevent severe complications and provide clarity. 7. Unintentional weight loss. Sudden weight loss without an apparent cause, such as diet changes, exercise, or stress, is a concerning sign. In prostate cancer, especially advanced stages, cancer cells consume significant energy, disrupting metabolism and causing nutritional imbalances. This can lead to rapid weight loss, often paired with fatigue, muscle weakness, or feeling drained despite minimal activity. The loss can be substantial, sometimes 5 to 10% of body weight in a few months. Unintentional weight loss is a systemic cancer sign, not exclusive to prostate cancer. The National Cancer Institute reports that about 30% of cancer patients experience this before diagnosis. It can occur even with a normal diet, creating unease that's hard to pinpoint. The psychological impact is significant. Physical changes can spark anxiety, especially if clothes become loose or loved ones comment on your appearance. For example, a man might feel embarrassed when colleagues note he looks thinner, prompting withdrawal from social settings. Weight loss often involves muscle loss, reducing strength and resilience, increasing injury or infection risks. If you lose over 5% of your body weight in 3 to 6 months without intent, consult a doctor immediately. Monitor your diet, energy levels, and accompanying symptoms like pain or urinary changes. Blood tests, e.g. albumin or CRP, and imaging, e.g. full-body CT, can determine if cancer or another condition is the cause. Early action not only aids diagnosis, but also offers chances to improve nutrition and overall health, strengthening you for the journey ahead. 8. Numbness and weakness in limbs. Numbness or weakness in your arms or legs is a grave symptom that demands attention. It often indicates that prostate cancer has spread to the spine, compressing the spinal cord. This compression disrupts nerve signals, causing tingling, loss of strength, or complete numbness in affected limbs. In severe cases, it can lead to loss of bladder or bowel control, severely impacting quality of life and requiring urgent intervention. The symptom may start subtly, like pins and needles in the feet, but can escalate rapidly if untreated. Spinal cord compression is a rare but critical complication, affecting 5 to 10% of metastatic prostate cancer patients per the Journal of Neurology. It can progress within days or weeks, risking permanent nerve damage or paralysis if ignored. The psychological toll is immense. Losing the ability to walk, grasp objects, or stand independently can trigger feelings of helplessness or identity crisis. For instance, a once active man might feel he's lost independence when relying on others for mobility, leading to depression or social withdrawal. This symptom is easily mistaken for other neurological issues, like disc herniation or vitamin B12 deficiency, delaying diagnosis. If you experience numbness, weakness, or tingling in limbs for over 24 hours, especially with signs like back pain or bladder control issues, seek emergency care or consult a neurologist immediately. Note the symptoms' onset, severity, and aggravating factors. An MRI of the spine or neurological tests can assess compression extent and guide treatment, from anti-inflammatory drugs to surgery if needed. Time is critical. Swift action can prevent irreversible consequences. Risk factors and prevention. Understanding risk factors is the first step to taking charge of your health. Age is the biggest driver. Prostate cancer risk surges after 50, with over 80% of cases diagnosed in men over 65. Family history is also key. If your father or brother had it, your risk doubles. African American men face higher incidence and more aggressive forms, requiring extra vigilance. Lifestyle matters too. Obesity, diets high in red meat, and inactivity raise risk, while plant-rich diets and regular exercise can significantly lower it. For prevention, knowledge and action are paramount. Start with a balanced diet. Foods rich in lycopene, like tomatoes, and fiber, like greens, are proven to support prostate health. Aim for at least 150 minutes of weekly exercise, from brisk walking to yoga, to control weight and boost immunity. Most crucially, don't skip routine checkups. PSA tests and prostate exams can catch abnormalities before they become threats. If you're high risk, discuss early screening with your doctor, possibly starting at 45. Prevention isn't just personal change, it's a mindset shift. Many men delay checkups due to fear or misinformation, but proactivity can alter outcomes. A New England Journal of Medicine study found that regular screening cuts prostate cancer mortality by 20% in men over 50. View health as a long-term investment. Small steps today yield big rewards tomorrow. Prostate cancer doesn't wait, but you can outpace it. These 8 signs, from frequent urination to limb numbness, are your body's whispers, urging action. Don't let busyness or hesitation block your path to truth. Early detection doesn't just save lives, it grants the chance to live fully with family, friends, and dreams yet to fulfill. Schedule a doctor's visit if you notice any of these symptoms. A simple checkup could be the turning point in your health story. We hope this analysis has given you insight and motivation to prioritize your health. If you found it valuable, please hit like, share it with loved ones, and leave a comment to share your story. Don't forget to subscribe for more vital health content. Together, we can raise awareness, break the silence, and build a healthier community. Your health is priceless. Protect it today.